Hey there! Did you know that some medications could be silently wreaking havoc on your cholesterol levels? Yes, it's true. According to a study published in the Journal of Clinical Lipidology, certain medications can increase LDL, bad cholesterol, levels by up to 20%. Meanwhile, emerging research has identified one common medication that can raise LDL levels by as much as 40%. Keep watching as we reveal this medication at the end of this video. While such meds might be crucial for your health, they can also have some unexpected side effects. That's why it's super important to keep an eye on your cholesterol levels if you're taking any of them. Join us as we discuss these medications. 1. Arrhythmia medicines. Alright, first up, let's talk about arrhythmia medicines. If your heart sometimes feels like it's dancing to its own beat, you might need these meds to keep it steady. This means arrhythmia medicines are essential for managing irregular heartbeats. But here's the twist. They can also tamper with your cholesterol levels. For example, amiodarone is great at keeping your heart rhythm in check, but it can raise your LDL cholesterol, that's the bad kind, and lower your HDL cholesterol, the good kind. This isn't just a minor side effect. It's something that can have long-term implications for your heart health. Imagine your arteries slowly getting clogged up with plaque. That's what high LDL levels can do. They increase your risk of heart disease and stroke. Not fun, right? So while these meds are doing wonders for your heartbeat, they might be silently changing your cholesterol profile. That's why it's crucial to have regular checkups with your doctor. They might suggest changing your diet, adding some exercise, or even prescribing another medication to balance things out. Don't be shy about asking questions and voicing any concerns. It's your health after all. 2. Beta blockers. Next on our list are beta blockers. If you're dealing with high blood pressure, heart problems, or even anxiety, you might be familiar with these. Beta blockers work by blocking the effects of adrenaline, helping to slow down your heart rate and lower blood pressure. Sounds perfect, right? But here's the thing. Beta blockers can also affect your cholesterol levels. Some beta blockers like atenolol and metoprolol have a reputation for decreasing HDL cholesterol and increasing triglycerides. Remember, HDL is the good cholesterol that helps clear out the bad stuff from your bloodstream. So lower HDL levels mean a higher risk of heart disease. And those elevated triglycerides? Well, they're another type of fat in your blood that can lead to hardened arteries or pancreatitis. So if you're on beta blockers, keeping a close eye on your cholesterol is a smart move. This might mean more frequent blood tests and a good chat with your doctor about your overall health. They could suggest lifestyle changes or add a statin to your regimen to keep your cholesterol in check. It's all about finding that balance. 3. Chemotherapy medicines. These powerful drugs are essential for treating cancer, but they come with a plethora of side effects. Among them is the potential to wreak havoc on your cholesterol levels. Chemotherapy can interfere with your liver's ability to process fats properly, leading to increased levels of cholesterol and triglycerides. This effect is especially notable with medications such as cisplatin and tamoxifen. High cholesterol can add another layer of concern for cancer patients who already have a lot on their plate. If you're undergoing chemotherapy, it's crucial to keep a close eye on your cholesterol levels. Regular blood tests are a must. Talk to your oncologist about your cholesterol and any steps you can take to manage it. Sometimes dietary changes or cholesterol-lowering medications might be recommended. It's all about managing the big picture of your health during such a challenging time. If you're on chemotherapy medicines, stick around until the end for tips on dietary changes to manage cholesterol. Enjoying the video? Be sure to give it a thumbs up, leave a comment, and subscribe to the channel. 4. Diuretics. You might know them as water pills, and they're great for treating high blood pressure and fluid retention. These pills help your body get rid of excess salt and water through urine, but here's the thing. They can also cause an increase in cholesterol and triglyceride levels. Ever heard of thiazide diuretics? A more common type is hydrochlorothiazide. These are pretty common, and they do an excellent job at what they're meant to do. However, they can raise your LDL cholesterol and total cholesterol levels. It's all because diuretics can interfere with how your body metabolizes fats, leading to those unwanted changes in your cholesterol profile. So, What should you do if you're on diuretics? Keep an eye on your cholesterol, of course. Regular checkups are essential. Your doctor might suggest a low-fat diet, regular exercise, or even a cholesterol-lowering medication to keep things balanced. It's all about managing your primary condition without letting your cholesterol levels run wild. 5. Immunosuppressive medicines. These medicines are real lifesavers for people with autoimmune diseases or those who have had organ transplants. They help keep your immune system in check, preventing it from attacking your body or rejecting a new organ, but yes, they can also tamper with your cholesterol levels. Drugs like cyclosporine and tacrolimus are the usual suspects here. They can increase your LDL cholesterol and lower your HDL cholesterol. High LDL is even more dangerous for people with autoimmune diseases because it significantly increases their risk of heart disease and stroke. And if you're a transplant patient, you definitely want to avoid any extra health complications. So, if you're on immunosuppressive meds, regular cholesterol checks are a must. Your doctor will likely monitor your lipid profile closely and may suggest lifestyle adjustments or additional medications to manage your cholesterol. It's all about balancing your immune system while ensuring your heart stays happy and healthy. 6. Retinoids. Let's talk about retinoids. If you've ever dealt with severe acne or other skin issues, you might be familiar with these powerful meds. They're derived from vitamin A and can work wonders for your skin, but just like any other medication, there's a downside. They can affect your cholesterol levels. Oral retinoids like isotretinoin, you might know it as Accutane, can raise your triglycerides and cholesterol levels. High triglycerides can lead to pancreatitis, and elevated cholesterol levels can increase your risk of heart disease. Not exactly what you signed up for when you wanted clearer skin, right? If you're on retinoids, keeping tabs on your cholesterol and triglyceride levels is essential. Your dermatologist might suggest some dietary changes, a bit of exercise, or even additional medications to manage these levels. It's all about balancing the benefits of clear skin with the need for a healthy heart. 7. Corticosteroids. And here's the one we've been waiting for. These anti-inflammatory drugs are used to treat a wide range of conditions from asthma to arthritis. They're effective at reducing inflammation and suppressing the immune system. But did you know corticosteroids can raise cholesterol levels by up to 40%? This was revealed in a 2023 study published in the Journal of Rheumatology. Long-term use of corticosteroids like prednisone can lead to increased LDL cholesterol and decreased HDL cholesterol. This happens because corticosteroids can interfere with how the body processes fats, and by now we all know high cholesterol levels can increase the risk of developing heart diseases. So, if you're on corticosteroids, it's very important to get your cholesterol levels checked regularly. As we've mentioned throughout this video, seeing your doctor is very essential. Now, we promise to share tips on dietary changes to manage cholesterol levels while on these medications. To help manage cholesterol, try to consume less red meat and butter. Instead, focus on foods like nuts and salmon, which are rich in healthy fats. Additionally, incorporating fruits and veggies like apples and broccoli into your diet can also benefit your heart. Thank you for watching. Don't forget to like, subscribe, and share your feedback in the comment section below. Be sure to check these videos.